As the debate over health care costs continues to rage, lawmakers on both sides of the aisle now say that research could lead to significant savings in the future. Here's a bit of what Congresswoman Michelle Bachmann had to say in her speech at CPAC.
You see, we cared in the 1950s when we had an absolute epidemic of polio that was sweeping over our nations. At that time, economists told us the annual cost to deal with polio would be something like $100 billion a year. If you translate that into today's dollars, you're talking more like trillions of dollars, or $1 trillion. And yet, those huge costs didn't happen to us. Why? Because someone cared.
Jim Pinkerton, contributing editor and writer for the American Conservative magazine, joins us now. It's great to have you here today.
Thank you.
It's not polio anymore, but we have other medical issues that we do spend billions, maybe even trillions, treating instead of curing. Do you think we need to change the conversation?
Right. I think we've got Alzheimer's, for example, which is a roughly $172 billion hit on the U.S. economy every year, headed toward $1 trillion a year, headed toward a cumulative cost by 2050 of perhaps 20 trillion with a T dollars total. Now that's a medical burden that nobody's health insurance plan can fix by itself. Not President Obama's, not Paul Ryan's. It will take a decisive intervention in the course of the disease, not the paying for it after the fact, but the disease before it happens, to change that. And that's what Mrs. Bachmann was talking about at CPAC yesterday. I thought it was very well received when she said, look, a cure is cheaper than care. So why are we letting the trial lawyers and the FDA strangle medical innovation today when we need these cures desperately, not only for humanitarian reasons, but also for fiscal and economic reasons?
Mm-hmm. And we've heard people from both sides of the aisle talk about this. It's not a partisan issue. I mean, they both agree that that is a feasible way to look forward to treating medical issues and financial issues at the same time. But how does this work? You mentioned, trial lawyers, FDA. Is it a matter of funding? Should that be public? Should it be private? How do we get towards this goal of cures?
I think you need some sort of public-private partnership, and you're quite right. There's Democrats as well. Rob Andrews, a Democrat from New Jersey, is on the same line that Mrs. Bachmann is. And the reality is there is enormous amounts of private capital waiting to be used for this, but frankly, right now it's not a good investment. I mean, if the FDA and the trial lawyers are there to kill off, and the number of new drugs approved by the FDA has fallen by 40%, the number of new medical devices has fallen by 40%, the amount of venture capital in the field has fallen by as much as 3/4. So in that kind of negative financial environment, even the best-hearted philanthropist will say, well, gee whiz, I could have more good or make more money doing something else. So you have to somehow create some sort of enterprise zone or X-Prize, some way, and with political leadership as well, saying, look, it is a national priority. When John F. Kennedy said we're going to go to the moon back in 1961, it was the public sector and the private sector mobilizing together to say, yes, this is an important national goal, and we did it.
Well, let's hope that folks out there are listening to you and to other political leaders as well. And I know that there are great concerns within the medical device industry about new taxes that are coming through the health care law that could stifle their ability to spend on this as well. So thank you for putting a spotlight on it, and we'll keep it there.
Thank you.